Hello everybody and welcome back. So if you like this video, just click the like and subscribe button down in the corner here. So the next technique we're going to demonstrate is a technique called a lift-off adjustment. It's for the upper thoracic or the CDJ, cervico-dorsal junction of the cervico-toro area, so between the neck and the upper back. Now this is classically used for the first 4 or so vertebrae of the upper back. And we're going to say, for the purpose of this, we're going to drop down as far as T4. So to quick find that on the skeleton, what we would do is we move directly across from the superior angle of the scapula, and that's roughly our T3 area. We're going to drop down one segment below to roughly our T4 segment. We're going to adjust above T4 up to the CDJ between C7, T1 as well. So, to demonstrate this technique, we've already tested the patient for the dysfunction, so we know we need to have a release in here. We're just going to talk you through the movements. So as previously, we need a towel. And again, this is a large towel, so we're just going to quarter roll, like we've expressed previously. So we're going to find our superior borders of the scapula, run straight across, drop down one segment to roughly where my thumb, so we're going to tilt this direction, roughly where my thumb is here. I'm going to place the towel on that segment to adjust above. I could go below and include that segment because we're adjusting the segment above the towel down to the segment the towel is placed at. Now, the patient stands with the feet slightly over shoulder width. The operator needs to place their foot in between. You apply your chest to the towel as a barrier. You ask the patient to place their hands on top of their head. You then tilt their head forward slightly, place one hand at the back of the neck, apply the other hand to the back of the neck, clasp your fingers together, make sure you have a little bit of play here. You then ask the patient to apply their hands on top of yours with their fingers interlaced. And then what we need to do, some people say look down, some people say look up. I find this more effective with the patient looking up. So I ask the patient to lightly traction their elbows together, look up towards the ceiling, and what we do is we rotate, find the restriction, which here is on the right side. Now again, Freud's laws are labelled after the ease of movement, but for the adjustment, I need to find the restriction. So rotate right is restricted versus left. We have side bend right, so we side bend, rotate right, which means we have to be worse than either flexion or extension. So we have extension here, side bend right, rotate right is the restriction. So we ask the patient, we're going to mobilise them round a couple of times. I'm going to ask the patient to squeeze their elbows, look up to the ceiling, big deep breath in, all the way out. And as the patient breathes out, collect the barriers and lift. And that completes our lift-off adjustment. And what we heard released there was our T3 on T4. Thanks for watching, guys.